My name is Greg Liptak. I'm the VP of Quality Improvement and Disease Management here at HSX. And our next panel is here to discuss the strategies to take an innovation and an innovative concept like PA Navigate and implement it. And some of the things that these organizations are already doing and some of the successes and challenges that they are already having with working with social determinants of health data, connecting patients to services, I think are all very relevant and important to hear and to learn from as we all work kind of at the regional and even state level to take PA Navigate and get it into the practices and CBOs and health plans that'll be using it, hopefully day in and day out. So one of the concepts that has kind of stuck with me through my training and career in quality improvement is this idea of the knowing-doing gap. And there's no doubt that everyone in this room, especially after hearing all of our speakers today, knows that social determinants of health are a primary driver of health outcomes. We know the importance of working collaboratively across our healthcare ecosystem to inspire change and to connect patients with the services that they need. But too often, and especially in healthcare, these innovations take a long, long time to kind of be accepted as a day-to-day part of your career, your practice. And there's a myriad of reasons for this. Not going to get into that now, but a lot of it is a result of kind of systems challenges, right? So we need to really think about how we're addressing workflow and process and using data derived from these activities and from PA Navigate and from the experiences of all of us and sharing that information with one another, creating kind of learning collaboratives where we listen, we learn, and we implement some of the best practices and findings from other organizations who have been able to do this work successfully. And I think our panel is going to be excellent in kind of describing some of those and also get you kind of thinking about what needs to be done and some of the challenges that we're all going to face and getting PA Navigate off the ground and implementing it more broadly. Start with the end, Stephen Rockwell, who's going to be finishing our conversation today from Benefits Data Trust, Najja Orr from Philadelphia Corporation on Aging, and then I'll ask Suzanne Cohen from the Health Federation to come and share her experiences. Thank you, Suzanne.
Thanks, Greg. Thanks, everybody, for sticking with us through all of this great content. I am really happy to be here today. This is me. I'm Suzanne Cohen. I'm the Senior Director for Population Health at the Health Federation of Philadelphia, and I'll tell you a little bit about what that is in a minute. So this is our mission statement. We're a public health nonprofit that since our founding 40 years ago has served as a regional network in southeastern Pennsylvania of federally qualified health centers. We have three main areas of work. I head up our population health department, and that's where most of the work that I'm going to be talking about today really lives. And that's work that we do really for and with our FQHC partners. We support them in optimizing health information technology, working with groups like Health Share Exchange. And we actually do this work with FQHCs throughout the state, so we also have the opportunity to work with some of the other health information organizations statewide. And I know that there's folks that we work with who work with you as well in South Central, so it's great to see you here today. We work with them a lot on getting access to and using data that reflects their work and also helps them understand what is happening with their patients throughout the broader healthcare system as well as other systems. We do a lot of work supporting their efforts in engaging in value-based care and payment. And we work very closely with health centers to try to improve the quality of care that they're providing across many different areas that they work in. Our other areas, we have a training and organizational development department that focuses on trauma-informed practice as well as clinical training for infectious disease, and a direct service arm that works with pregnant and parenting individuals and families doing home visiting programs with very high needs families who need support. So that is us. And we do a number of other programs as well, and I invite you to check out our website at healthfederation.org. But today I want to talk some about the federally qualified health centers in the Philadelphia area. And I think, this is information that obviously a lot of you already know. I see many of the FQHC's partners in this room, so I hope I'm not being too repetitive. But I think sometimes people are unaware of really the breadth and the size of this network in southeastern Pennsylvania. So we have more than 15 FQHC organizations in southeastern PA in the 5-county area, and they have nearly 60 care delivery sites, and they really are all over the city less widespread in the suburban areas, but really in the suburban pockets of poverty that we have throughout the 5 counties. And we serve almost 300,000 patients, unique patients a year. And the services that are provided are comprehensive primary care. So that means throughout the lifespan, from prenatal care to infant care, kids, teens, adults, elders, and not only medical care, but dental care, behavioral health care. And health centers have always done a lot in the social care arena as well. So they have a wide range of partnerships and in-house services ranging from providing access to legal counsel for patients, transportation, benefits counseling, including insurance enrollment, food and nutrition services, and many, many others. So this area of social determinants of health and health-related social needs is, of course, by no means new. And one of the things that, of course, distinguishes FQHCs from other healthcare providers is that all of these services are provided without regard to a patient's insurance status or ability to pay. So while many, many of our patients have Medicaid, have Medicare, if you're uninsured, you're charged on a sliding fee scale and no one is turned away. So speaking specifically about this area of social needs resources and referrals, FQHCs have been doing screening for social needs. I mean, they've been asking people their incomes and characteristics like that for many, many years, unlike most healthcare providers. But more recently have, within the past 5 to 10 years, have really been screening fairly universally for a broader range of social needs. Thanks to some funding from DHS, from the state, for which we're very grateful, we were able to engage with Find Help, which at that point was still called Aunt Bertha, and stand up an instance of Find Help for many of our partners. And we branded that Connect for Health, and it's been around for about 5 years now. And the folks on the screen are the partners that we are directly engaged with on that platform. And in some ways, it's a little bit of almost like a mini PA Navigate, because we, with our Find Help license, we were able to provision out access to this platform across these different partners, some of which are federally qualified health centers and some of which are community-based organizations. So that's really the experience that we're able to come to this table with. We've also done a lot of work with HealthShare Exchange and the FQHCs, so it's really nice to see these worlds coming together. So we have these 5 years of experience really focused on engaging federally qualified health centers and community-based organizations in a social needs referral platform. And we're super excited that we are moving forward with coalition sharing with PA Navigate. So we're really looking forward to that ability to have the folks who've been using Connect for Health be able to see what else is going on in the ecosystem. And I actually feel like this is getting potentially to some of your question, that if we're all really able to engage with this platform, and if our navigators and our community health workers and our folks who help people get these resources use it to really document and track their referrals and see what's happening, and then we all have that visibility into it, we have great potential not only to have the data, but to have that history for the individual clients and patients that really demonstrates whether they've gotten the help that they need. So I really appreciated your question, and I think there's a lot of potential here. We just have to make it work. We have used Connect for Health and this concept of community clinical linkages in a number of projects over the years that have really focused on chronic disease, so diabetes, hypertension, where we've worked with health centers and with community-based organizations, and we're continuing to do this work, to really activate workflows within the health centers so that they are referring to social services providers for specific populations that are at risk for or living with chronic disease. And this is the kind of work that we are really excited about seeing, being able to dig into statewide with PA Navigate and to really sort of leverage and kind of supersize, I guess. And there's a lot of experience here with screening for social drivers of health, engagement, training, and support of community health workers, and navigation both to clinical care and to social needs referrals. These have been key parts of these efforts, and we're really excited to move that forward. So I'll just give a few lessons learned, and as I wrap up, and they're not so much lessons learned as lessons we're in the process of learning. I mean, there's still tons of learning going on from our patients, from our community members, from our providers. But I think one really important piece, we all love the idea of sort of these automatic or almost automatic electronic loop closures, right? And that would be beautiful. But I think what we have learned over the years is it really is about navigation. It's about the community health workers and the navigators and the social workers who are in the platform making those referrals, but then they're picking up the phone a lot of the time and saying, hey, did this person get help? Can you go into Connect for Health or Find Help or PA Navigate and close that loop for me? Can I close that loop and say, yes, this person got help? I don't think that workforce is diminishing at all in importance when we move to PA Navigate. Another thing that we see, and now we're coming from community providers, right? We're not health systems. But we really see that the need for a lot of bi-directionality. So not only do the health centers want to refer to social service providers, the social service providers are seeing folks in their communities who don't have health care, and they want to refer back to the healthcare providers, and we have to have that openness to take those folks, right? Because that's the kind of exchange and communication and collaboration that really will make this work. And I know that can be much more challenging. It's challenging in health centers too, right? Getting someone into healthcare is hard. Can this platform be the mechanism? Maybe, or part of the mechanism, but it's definitely something that has to be part of our conversation. And I'm gonna say one thing about data, which is that we see, having worked with many federally qualified health centers on social needs screening and attempted to work with them on coding that data so it does get to their payers, this is really, really hard. We don't even have consensus between the state and the feds and different agencies about what code sets are supposed to be being used. And we've been working for years with these folks to try to get some kind of standardized coding, get that data to their payers. And it's a lot of energy that's not going into the screening or the connecting people to resources. And I think we really have to think about what are other ways that we can get structured data about social needs to the folks who need to see it without focusing so much on coding. So that's my little anti-coding message. But and I'm just going to finish with a little advertisement. We are doing an event at the end of July, which we're very, very grateful to have some HealthShare Exchange support for. Thank you, Bill. And this is an open event for community-based organizations that are interested in learning more about whether it's Connect for Health or Find Help or PA Navigate, because really they're all going the same place. Doesn't really matter which door you go in through, and soon we'll all be sharing information across those silos. So if you're interested, if you're a community-based organization who wants to learn from the Health Fed team who's been doing this work for a long time, wants to talk through what it means to engage with this platform, please come out, or if you have partners who are interested, we would love to have you. And I have a few paper flyers too if anybody wants them.
Good afternoon, everybody. Again, my name is Najja. I'm the President and CEO of the Philadelphia Corporation for Aging. It's a pleasure to be here with you today. Last year, at the end of the year, we celebrated a milestone year as our 50th anniversary as the Area Agency on Aging here in Philadelphia County. And you'll see here our language with our mission statement talks about us improving the quality of life for older Philadelphians and people with disabilities. And the reality is we always want to be the front door, the side door, the back door to all things related to supporting older adults in the community. A lot of what we do really started with the Older Americans Act of 1965, which led the framework for there to be federal, state, and local offices, with the AAAs being those local offices, to support older adults in the community. And we affectionately call ourselves AAAs, but of course you wouldn't call me if you need your car towed with the other AAA. We are here in Philadelphia at PCA one of 52 AAAs across the state of Pennsylvania, and there's over 600 across the nation. We are designated in Pennsylvania here as either nonprofit or local government. My last agency that I worked at, I was the director of the Bucks County Area Agency on Aging before I came to PCA. There I was designated as local government, answering to the county commissioners and human services director. Here in Philadelphia, we are a nonprofit AAA. And you'll see on the right side, of course, we do answer to the Pennsylvania Department of Aging, who answers, of course, to the federal agency, the Administration for Community Living, under the Department of Health and Human Services. In our supports in the community, we really follow three paths as we're supporting not only the consumer, but their caregivers. That first path, making sure we do our part to help people stay connected to the community. That's making sure people stay engaged with programs like the senior centers, health and wellness programs, volunteer opportunities, civic engagement, things like that. And then there's the middle path, where we send our staff into people's homes to complete comprehensive assessments, to really tailor specific care plans to meet their holistic and specific needs. And we'll put services in the home, things like home delivered meals, medical equipment and supplies, personal care. We'll connect people to adult day services and things like that. And then there's that last path, advocacy and protection, where we connect people to the Ombudsman program who have questions or concerns in a long-term care setting and need those questions or concerns answered. Connect people to legal services. And then, of course, last but not least, our older adult protective services department, where we do investigate elder abuse for those at risk for abuse, neglect, financial exploitation, and abandonment. So while we talk about the social determinants of health a lot as a newer coined phrase, a lot of community-based organizations have been doing this work for a very, very long time, making sure that we look at those social and other factors that really impact a person's health. And so we're constantly asking ourselves at PCA, what are the things that we could do to make sure that our programs, our services, are really connecting people to the right programs, and it's really truly making an impact on their health care, as well as what are the social things that we should really be touching on to make sure, again, that their health impact is improved. We at PCA have more than 30 programs that support about 140,000 individuals in the community each year. And we are, fortunately, the largest area agency on aging in the state of Pennsylvania, one of the largest in the nation. We are, as an area agency on aging, since we receive those federal and state dollars, we're required to complete a 4-year plan, which then informs the state plan on aging. And our most recent 4-year plan, we're actually in the middle of wrapping it up so we could talk about the next 4 years and how we will support older adults in the community. Our current plan, looking at things like innovative best practices to make sure that we're really focusing on consumers that really need support in the community. Again, looking at improving ways that we really ensure that our programs are linked to those social determinants of health. Inclusion in person-centered practices to make sure that we're focusing on DEI and it's a part of our DNA. Promoting the rights and safety and protection of older Philadelphians. And again, as I mentioned, those older adult protective services, legal services, ombudsman programs like that. We want to make sure that our older adults are safe in the community. And then those data-driven, evidence-informed planning, we're asking the same question that the young lady asked in the back. We collect a lot of data. But what are we doing to make sure that we're assessing and analyzing that data to ensure that the programs that we're providing in the community are really truly having the impact that we think they are? As we look at the next 4 years, over the last few months, we've been drafting our next 4 years. And mid-June, we'll be having our public hearing to talk a little bit about our next 4 years, to talk about the state budget and a few other things that we'll be addressing. But of course, over the next 4 years, we'll be looking at continuing to address the Older Americans Act Core programs, again, to make sure that those federal and state dollars are really utilized to support people in the community as best to meet their needs. While we talk about COVID-19 being on the tail end, are we really on the tail end? We want to make sure that we continue to educate people about the importance of vaccinations and anything we could do to be a resource for those individuals that are interested in vaccinations. We want to be that resource. equity. We continue to talk about, again, making sure that diversity, equity, and inclusion is a part of our DNA, and it's steeped in every program and service that we provide to the community. Expanding access to home and community-based services. While nursing facilities are a tremendous resource for those individuals that are eligible and want to live in a facility, the reality is most people that I speak to, and I've been doing this for a while, want to live in their homes and community. So again, how do we make sure that we balance that right for individuals who want to choose to stay in the community and live in the community as long as possible? And then finally, as we look at the needs of the consumer, we have to make sure that we're continuing to focus on the needs of the caregiver. Oftentimes, it's the caregiver that makes the difference on whether somebody could safely stay in the community or not. So how are we focusing on the needs of the caregiver, providing respite, providing supports to that caregiver as well? We've been talking today about closing the loop, and this is something that we continue to ask a lot at PCA as well, because I think of my older adult protective services unit as they're going out at 11 o'clock at night, 1 o'clock in the morning, 2 o'clock in the morning, and seeing individuals that are at risk for abuse, neglect, financial exploitation, or abandonment for those emergency cases. And to be able to have access at their fingertips is something that I think is critically necessary. Again, asking the question the young lady asked in the back there, are we sure that the data we're collecting is really making a difference? But also, we want to make sure that we have it at our fingertips for those emergency cases, the times that we need it. We're fortunate here in Pennsylvania because we do, in addition to all the services that we provide at the AAAs across the state, we do have the Pennsylvania Lottery that supports the services that we provide. So in addition to the services that we provide, it also assists with written property tax rebates for older adults, transportation services, and then we have our state PACE director here, Tom Sneddon, joining us today for those individuals that need assistance with some prescription drug coverage. So again, it's making sure that we talk about the right partnerships, making sure that we continue to have conversations with HSX and the other HIEs across the state so we can have real access to the information at the time that we need it, and making sure that we're really breaking down the silos, because where the system works best is when there's better communication, better collaboration between the CBOs, the medical providers, and again, those payers. Because again, I think about my older adult protective services unit who are out in the community, and at their fingertip, they should have access to information that'll really help guide their decision making while they're tackling that emergency. Who's the consumer service coordination entity? Who's their home care agency? Those are the kind of things that they need at their fingertips. And I think this has been a conversation that we've been looking forward to for some time, because again, we are part of that next part of the conversation to say, how can we do our part to ensure that loop is closed? So with that said, I'll go ahead and pass it back to Greg. Thank you.
Good afternoon, or maybe good evening to everyone. I'm Stephen Rockwell. I'm the Chief Digital Officer at Benefits Data Trust. I've been spending most of my time on AI these days, but for now, in this session, I will put my data nerd hat solidly on and sort of just speak from that perspective. Who is Benefits Data? Tom's here. He could probably give this presentation better than me in terms of who is Benefits Data Trust. It's one of the founding fathers of our organization and longtime partner. But we're a national nonprofit. We harness power of data and technology. We do a lot of policy work, and we do a lot of direct service. And so that sort of direct service with policy, with digital, is our operating model, and we sort of think we can make change with that operating model. We're sort of in the business to solve the benefits access challenge. This number is unfortunately going to go down because the ACP doesn't look like it's going to be renewed. It's going to go down to about $60 billion. That's still left on the table. It's still a big number that's left on the table, right? That's the big sort of audacious problem we're trying to address, and we actually believe we can solve that over the next 10 years. And so we have a strategic framework that that we think if we sort of collectively adopt some of these things, we will actually solve the challenge. It's a solvable challenge. And so I'll just sort of mention what those pillars are. One is eliminate unnecessary steps in paperwork. We all still struggle with that, right? We've made a lot of progress on automation. We've made a lot of progress, recertifying in different ways that don't require as much paperwork, but we know that that's still very much an issue. We also believe that we want to build the intelligent benefits access system. It's proactive. It's knowing what issues are and anticipating those issues and getting to people, at the right time with the right message. I think what we heard from the Secretary earlier is absolutely true, that PA Navigate and the Commonwealth are much further ahead in some cases compared to some of the states that we operate in. And so we've got a work cut out for us on that, but that is also where sort of the AI pieces sort of come into play. And then we have to grow government's capacity to do that. You all know this data better than I do probably, around sort of what some of the outcomes are as it relates to SNAP, older adults. We've spent a lot of time sort of thinking about, at scale, how do we do our outreach work better, right? And so we get to enlist ingestion from a managed care organization or state agency. Part of what we're starting to do is enrich that data as much as we can to know as much as we possibly can about with whom we're going to contact. And we use public data sets for that primarily, although we are starting to use more individualized data, and HSX has been sort of a great partner in that over the last few years. This is a long slide, I won't go through it. Sorry about that, but I'm gonna keep it going. HSX does a great job in this space, in this Commonwealth, and around data sharing. But this is not something that's sort of been sort of commonly pursued. And so we've built a data sharing playbook that we released last year. I'll just give you one vignette around this. The Federal Data Hub from CMS. Turns out that for years there's been this rule that you can only use it for healthcare related things. If you're doing something healthcare related, you can have access to the data. We talked to the White House, the OMB and the U.S. Digital Service on this, and we're like, hey, this would be really useful for other public benefits. Why don't we get access to that? They started doing some digging at our sort of nudging, and they found out that this is not it's not a statute. It was literally an opinion from someone at CMS from 8 years ago. And that's how it became the law. And so we're going to go pursue that. Let's see if we can open that up, right? And those kinds of that's a federal conversation, but these kind of conversations obviously happen state by state, agency by agency, and we do things to sort of help facilitate that. And what else do I want to say? Just to say that, obviously we've seen really great success by this, right? And I'm sure some of you have by participating in the exchange. You're seeing really successful numbers. We had a conversation earlier about outcomes. It does seem like that is a piece that we could add into the mix sort of in aggregate, because there's both sort of outcomes at the individual level, but if we've got all these interventions, that map I just showed where there's a bunch of red, no matter what the issue is, we should start seeing that be yellow or green over time. And if it's not, in aggregate, policymakers and those of us who are working in those spaces and in those communities need to take another look. need to sort of redouble our efforts. We need to, right? And so paying attention to those top level indicators is going to be, I think, an important challenge moving forward. And it is one of these places where sort of well-governed data, you can sort of start leaning into predictive modeling and things like that to help with that. And yeah, this is a long slide, too much text on it. But just to say again that when we engage this work, we see real outcomes, and it makes it really worthwhile that we are collectively in this, doing this work together. And there's like a network effect that happens, right? The more that people are participating either in exchange, the more that people are participating in PA Navigate, that it actually creates more value for those participants, right? And so I think we're on the right path here in the Commonwealth, and hopefully we'll take some of the lessons that we're learning here with all of you and apply it in other contexts. So thank you.
Back on for a second, because the topic on people's minds, and we've heard from Suzanne about the challenges in data quality and consistency that comes as it relates to SDOH screenings. We heard from folks in the audience who, representing CEOs, have all sorts of data that supports the rationale for their existence, right? And the support that they're able to provide these individuals. Some of the data is very heterogeneous, right? So we had a lot of probably hard time aggregating that and working with it to either prove out that certain interventions are working or showcase that there's more researchers that are needed in certain areas. So how do you think AI can help us address this in aggregate as a kind of a region?
Yeah, I think the value is that we're already sitting on a lot of very well-governed data, right? And to build an effective model, whether it's predictive AI or even generative AI, like that well-governed data is really important. And so we have the building blocks to sort of do this well. We've taken this in a couple of different directions. One of the big ones is some of what we heard earlier about intervention recommending, right? And so from this well-governed data, being able to generate a set of prescriptions in a fairly sophisticated way based on what we know is working both from clinical data, policy data, and what we're seeing in our actual sort of service delivery data to be able to generate those kinds of interventions. There's obviously, the Commonwealth, right, that executive order that we saw and what's happening right now is really focusing on efficiencies and intelligent automation and sort of where can we continue to see some more efficiency in the system. Those are really important avenues too. But when we're thinking about sort of solving the benefits access challenge and building an intelligent system, we really are leaning into that intervention recommending early on, working with caseworkers. So we have a grant that the Gates Foundation and Google.org are sponsoring, where we're sort of building that corpus, those AI models, and then we're testing it out and piloting in our own contact center and also in other contexts where you have caseworkers or social workers who it's sort of going to be their companion as they go along in their journey and hopefully better able to assist, looking at both sort of like the vagaries of benefit rules, sort of all those edge cases, and also getting better information referral and interventions to right away to a caseworker who has someone presenting to them in real time.
Okay, well, I'm going to close us out on just one more announcement, actually. So we were fortunate as HSX to receive a grant award from the IBX Foundation within the last couple of weeks. If there's anyone here from the foundation, thank you very much. Aha. All right, good to see you. Very excited to launch this project, and we're just kind of starting our kickoff procedures now. And this is really focused on seniors with diabetes or pre-diabetes and trying to understand both their current needs through social determinants of health screening, as well as how we can facilitate as HSX their referral and actioning on those needs into organizations like PCA, like BDT. And this presentation was kind of our first real understanding of how are things working currently with FQHCs and health generation. What are they currently doing? How is BDT and PCA addressing some of these needs? So very helpful to us, panel, for understanding where we can go with this, and we'll continue dialogue with you around this project and others. Before we close out our session here, any questions for the panel? No? Okay. Well, thank you again, everyone.